Welcome to Medically Speaking. My guest today is Dr. Chelsea McCabe from the Children's Psychiatry Clinic, a division of Oishei Children's Hospital. Doc, thanks for joining us today.
Thanks for having me.
Let's start off, talk a little bit about you before we get into the psychiatry clinic and then some of the trauma programming we're going to talk about. Tell us a little bit about your background, how you got started, how you ended up where you are today.
Yeah, so I'm a Buffalo native, and I actually went away to grad school in Miami, Florida, for Florida International University, and trained with Dr. Pelham, who we used to have in the Buffalo area. And then I actually did my internship year at the Medical University of South Carolina at their Crime Victims Center. I went to Rochester for my postdoctoral fellow at the University of Rochester Medical Center, and then made my way back here. Couldn't stay away, and have been at Kaleida for the last 4 years.
And in particular, you're associated with Children's Hospital, correct?
Yes, so I'm housed in the Children's Psychiatry Clinic that's housed under Oishei.
Okay, let's talk a little bit about the clinic. Where's that located, and what kind of population does it serve?
Yeah, so we're located at 1028 Main Street. So if you are at Oishei, if you walk through to Conventus, we're right across the street from the Conventus Center, like a little bit diagonal. We're right on the second floor. And we see anyone really from birth. So we are starting to do some groups with some pregnant moms, but we'll see, as young as like 12 months sometimes, up until age 20. And we try and see, and anyone that is in the community right here in Buffalo, but we also see some of our surrounding suburbs and also do a lot of virtual work too for some people that are further away. We also have a satellite clinic also located out in Amherst, right by UB North Campus.
And then, so if you're a mom or dad watching this, and you think your child may have some issues or there's a need for a referral, how does one family and or a patient end up getting through your doors? What type of referral pattern or chain is there?
Yeah, so we try and make it pretty simple. You just would call our intake number, which our number is 859-5460. And what you do is just call and leave a message, and we typically return the call within 72 hours and have you complete an intake, get your insurance information, and then get you set up with an appointment with one of our providers.
I know we want to talk about childhood trauma, but before we get there, if you can, for a minute, talk about child psychiatry, what child psychiatry is, and what you guys are designed to do.
Yeah, so if you were to call and get services with us, we originally would set you up with a therapist, which that would entail kind of having an intake session where we kind of get background information on you, your family, your child, or your and information just to see what's been going on, what are the struggles you're having. And then from there, you kind of get assigned to a treatment plan with some goals that you want to work on, different treatments that available options that we have. And then if needed to, we have psychiatry. So there's therapists, which are psychologists and social workers. And then we have psychiatrists who would prescribe medicine. If that's needed as well, we can make a referral to our psychiatrists, which are in-house here, which is very nice. And it's a collaborative approach.
That's great. And it's a great differentiator and helps the viewers understand, the differences. And then again, one more clinical definition or explanation. The difference for those who may not know, the difference between behavioral health and mental health, and just some of the areas you just touched on. What falls in the behavioral health category? What falls in the mental health category?
Yeah, so they overlap a lot and are used interchangeably a lot now, actually, which I think is a good thing to be able to just encompass more for people. But when we're thinking behavioral health, we kind of think of behavioral disorders and thinking about kind of like a lot of like outbursts, right? Behavioral stuff that is being attended to. And then mental health is kind of more of our like emotional disorders when we're thinking about like anxiety and depression, as well as behavioral health has now been starting to include kind of that overlap of kind of medical disorders and when we have some of our mental stuff that is impacting our medical disorders and being able to encompass all of this under behavioral health.
I know we wanted to spend a little bit of time talking about childhood trauma. So if you can, let's start with how you guys define childhood trauma and then why addressing it becomes so important.
Yeah, so we refer to trauma as kind of a set of symptoms that a person might develop after experiencing a distressing event. So that could be something like childhood abuse. So that would be kind of physical abuse, or can be mental abuse or sexual abuse, or it can also come from like assault or a natural disaster, a death of a loved one. That's not an all encompassing list, but just an idea of what could be a distressing event. And then we also look at chronic negative events that can be considered traumatic. So that if you are experiencing maybe not one big event, but you are just experiencing one negative setback after another, that this can kind of create a chronic traumatic experience for someone. And then your second question of kind of why are we looking at trauma, especially within our own community recently. One, everyone has experienced COVID, but we've also just had a lot with the top shooting that happened last May, with the blizzard, even just the earthquake that happened. My little nephew, who was okay with me sharing, said right when the earthquake happened, he thought a car hit his house and he was laying on the floor crying. So even something as what would seem as insignificant of the earthquake here as far as damage, can be pretty traumatic for someone, as well as again as just community events that have come up.
So you mentioned your nephew on the floor crying, obviously a tangible sign of trauma. What are some of the other signs of trauma in kids and things that parents or loved ones could be looking out for?
Yeah, so one, it's actually pretty typical to have, after a distressing event or an upsetting event, have things come up for about like a month. And that if it keeps going is then when we're starting to think about like what we call post-traumatic stress disorder, where something would be like a little bit atypical and we might want to get help for it. And then also just being mindful that some of these behaviors just occur in kids. And so what we're looking at is really a change in behavior. So if something after this event happened, you start seeing these things in your kid, that's more of what we're looking for, is that it being impactful. If some of these behaviors are going on without trauma, that's a concern too, and we can help, but it might not be related to a trauma. So yeah, crying on the floor, nightmares, belief that the world's unsafe. So kind of checking for safety or checking for if things are okay, asking a lot of what we call reassurance seeking questions. One of the biggest things that we see is actually irritability. So this can look at like anger, moodiness, kind of aggressive behavior. You also can see poor concentration, appetite or sleep issues, also just a lot of anxiety. So nervousness about getting close to people, jumpiness from loud noises. And then in teens, especially, we also like to look at use of alcohol or drugs.
So obviously, this is a very difficult topic and probably especially difficult for parents to have to deal with and or address, so that they're not missing signs of potential trauma. They're reading it right, reading the situation right, or they're making sure they're not missing things. What advice do you have for parents who may be watching?
Yeah, so I think the number one thing that I always like to tell parents is that children often don't express the emotions that they're feeling in a way that's easily recognizable, right? That this is part of developmentally appropriate for them, that they are learning. And so one, for parents to model kind of talking about trauma or what happened so that their child is able to kind of use that same language and talk about how they're feeling. But also, I think one of the biggest challenges is we have that when kids misbehave, we also often are using disciplinary strategies instead of support strategies. And we know that because behavioral outbursts are one of the most common things that happen after a trauma, we really want to try and change our disciplinary response into a supportive response. And this is particularly important at school too. So that's why I always recommend people fill in to the teacher, like even if it's like a quick note in the morning, like, hey, this happened this morning. And so they might have an off day, right? So that they get more support from the school than they would in their teacher than a discipline response. And so even as simple as the language, if a child is struggling when they come into our office, when they're talking about, hey, my kid is, crying a lot or screaming, and really stick to what the behavior is, and rather than label it as like a tantrum, to actually say they're angry or they're frustrated and they're unable to express themselves after this happened. Because once we start using the labels like tantrum or they're acting out, things like that. When we use that language, it actually can bring a lot of shame to your kid. And we want to be mindful that here that they are experiencing, especially again, if this is in response and they weren't experiencing these outbursts before, that then, we are able to kind of bring that supportive language so that it encourages them expressing themselves rather than having this response that's shameful. And then again, kind of right along that is just being able to just be that support. So maintaining a routine, allowing for questions, acknowledging how your child's feeling. So yes, I can see that you're worried, instead of like, oh, don't be worried, it's fine, right? We want to actually kind of be our child's biggest support, to be able to just help them understand that, they are okay, even though this event happened. And one of those things is kind of hope, right? Being able to, if there was a natural disaster, hey, people from all over the country are sending medical supplies, or, being able to talk about the food drives that are happening or donations. And if it's appropriate for your child, maybe to make a donation with you, to drop one off if you are able to do that. Or again, go seek those resources from the community that come up when the traumatic events happen.
Doc, that's awfully helpful and very, very informative. How do they reach the clinic, or how do they make that appointment? I know you mentioned it earlier, but if you can, let's make sure people can get a hold of you guys.
Yeah, so again, our intake here was the 716-859-5460 number calling. Also, schools and pediatricians now are great resources, right, as a first step, especially if you're not at the point where, we're thinking that this is, a post-traumatic stress disorder, like the actual diagnosis, but they're just having some. There's some resources that you could get from the school or the primary care, but also coming to us. And again, being able to just get connected to services earlier so that, this isn't continuing.
Yeah, very, very helpful information. Such an important topic. Doc, thanks for joining us today and sharing so much about the psychiatry clinic and all the work that you guys are doing, all the community, and for the patients that you serve.
Great. Thank you for having me.